Hello little buns, it is Steph. Welcome back to my home. It has been well over, I always start these update videos with, it has been, why can't I just be more creative and say like, 12 years have passed since the drums of, why can't I just do something like that? Why do I gotta be always doing the same thing? Point is, a whole year plus a month or so have passed since I had my FFS, my facial feminization surgery. If you guys were not there for the ride with me, if you're just coming in now to this video, I did like 8 or 9 videos on my entire surgical process. I vlogged the consultation, I vlogged every day after recovery. Like, you can see the entire process on my YouTube channel. I'll put a link in the description box to that playlist where you can go from before it's happened all the way to like I felt fully recovered. But the doctor told me that I would not really officially be fully recovered for an entire year, just because it's a very invasive, intense surgery and things have to cool down after. Like, it has to calm down, you know what I mean? It has to chill the fuck out. Yeah. So now that it's been like a year and a month, I'm gonna talk about it. I've tried recording this video probably a good 5 times, and I always either am wearing too much makeup, so it's like kind of hiding the surgery, or I do something that just makes me not like the video. So we're gonna get it right this time. It's gonna happen, okay? Because I wanted to post this like 3 weeks ago. We're gonna make it work. Quick thing before we get started, I do want to mention the doctor that I went to, okay? The doctor I chose was Dr. Spiegel in Boston, Massachusetts. I will put a link to his website in the description. The reason I chose him is because he delivers an extremely natural result. The result that still looks like you still resemble yourself. It's just, you know, maybe you didn't go through testosterone puberty, right? The boy puberty. You didn't go through that. You went through a regular puberty for a woman. That is what I wanted as a result, and that's why I chose him. Of course, you know, even with him, I'm sure if you told him you wanted a more dramatic result, maybe there's something there. I'm sure he's flexible, right? But I chose him because I wanted that natural result. And I think that's what he's very, very, very good at. So I would recommend him for sure if that's what you're interested in. What I did to make sure I got the best possible video for you is during my live stream on YouNow, which there's a link to YouNow in the description. I live stream there several times a week. You can go hang out with me there, okay? I asked you guys what questions you had about being 1 year post-op with facial feminization surgery, so I'm gonna answer those after I recap what I actually had done. And I'm gonna show you a video of me before surgery just so you can get a better idea of how much has really changed. So I'm gonna go over here or over here maybe? Over here, I want this side. So I had 5 separate procedures on my face as part of facial feminization surgery. I'm gonna go from top to bottom with my face. So the first thing, if you're going from the top, is my forehead reconstruction. It was completely changed. It wasn't a shaving down of the brow bone because he doesn't just work on the brow bone, he worked on the entire forehead area, just to make sure it was very cohesive with the rest of my face, including the part where my nose attaches to the forehead. So as you can see, my forehead now is very smooth, very flat. It's still like the skin still has roughness and texture because it's not the skin he was working with, it was my bone, but I'm amazed with the result I had there. Moving down the face, I had a lip lift, which was right here. How that works is they remove a piece of skin from your face. It's kind of like an M shape with the points of the M on the top in your nostrils. They remove it so there's a hole in your face, and then think of it like you put a hole in a sheet, okay? And then you pull the bottom of the hole up to the top of the hole and sew that shut. What's that gonna do to the bottom of the sheet? Is it gonna be a straight line? No, it's gonna have a curve in it. And so the same thing happens with your lip. So that's the reason why now when I have like if I just statically have my mouth open like I'm not doing anything, it has that really cute pout look, and I'm very happy with that. I think it's adorable, and I love it. And then a separate thing that he did as part of that while he was in there is he took that tissue he removed from my face, he took off the top layer of skin, he reshaped it, and he put it inside of my lip, almost like a permanent implant, except the difference is it will change with my body because it is organic tissue, it's my tissue, it's not like a silicone implant that will forever stay one shape. You know what I mean? I think there's some risk factors when you go with an actual implant, but because it's my tissue, it looks very natural, it's very subdued, and that was to increase volume of the lip so that it has more shape this way, right? So I'm very happy with that. Moving further down, that's 3 out of 5. Moving further down, we have the Mandible Contour, which is really just an entire jaw reconstruction as well, except this one was done like a shaving of the bone. It wasn't a total breakdown and reconfiguration. And the way he did this was he worked from inside of my mouth and he made 3 incisions and he worked, you know, from there. So there's no outside scarring with my jaw, 0. And he went hard on my jaw, and I'm very happy with that because, and I'll play a clip of this. In the consultation, I said, fuck my jaw up.
Okay, so let's talk about your jaw.
Okay, yes.
Okay.
Yes.
Let me feel your jaw here.
Go handle my jaw. My jaw, like, do whatever you want. Like, just fuck it up. I wanted it so bad, and I'm so happy with the way my jaw looks. It has a way more rounder look. There's no comparison to before. It looks so much more delicate. My chin was very asymmetrical before, and he managed to make it very symmetrical. Sometimes because I still do have a tiny bit of facial hair that I have to handle. Sometimes on the worst days where I have to shave and there's a lot of irritation, it can kind of swell up a little bit and it looks very uneven. But on good days when my skin is really behaving like today, it looks 100% symmetrical, and I'm very happy with that. That's great. That being said though, nobody's face is really symmetrical. So, you know, you can get all these surgeries, but there's still gonna be something off. And that's totally normal because literally nobody's face is symmetrical except for like Brad Pitt and Angelina Jolie, maybe. But even them, they're probably not symmetrical, okay? And moving further down, the last thing I had done was my trachea shave. Now, I cut this scar a few days ago, so it's been kind of bleeding, so it might look kind of red, but overall it's not very noticeable. The way he did this, and for those of you that don't know what trachea shave is, it's when they remove the Adam's apple or they reduce it as much as they can without harming your vocal cords. They couldn't do like a 90% reduction, which is what most people get, I believe, or maybe it's the other way around. Either way, they couldn't do a full removal because that's just really risky to your voice, and I didn't want to hurt my voice at all. I didn't want any risk there. So he did this in a way where he puts a camera down my throat and he sees exactly where he has to remove things and how much he can remove without damaging anything else. So he did a really good job there. And then he makes an incision higher than the actual trachea, the actual Adam's apple, right? So that the scar is kind of hidden when you have your head down, and it looks kind of like a scar you'd have if you like fell as a kid and hit your head off of something and split your neck open, which is pretty brutal sounding, but I have no problem with the way it looks. I'm very happy with that. So now that that's done, let's get into the questions you guys asked me. I'm just gonna go down the list from top to bottom. Any scarring. Okay, so I do have 2 scars. One of them is the trachea shave incision, which causes me no grief at all. The other one is in my hair. I should have mentioned this when I mentioned the actual forehead reconstruction. He made the incision inside of my hair. If I was getting a hairline movement, like if he was making my hairline lower, for example, he would have put the incision right along it so that he could just stitch it lower. But he didn't want to do that. He said he liked my hairline, and I was like, cool, thank you. I like it too. It's fine. He did it in my hair, and so I do have a scar in my hair that's sometimes visible when I have my hair pulled back. Right now it looks pretty good. I don't think I can see it. You've seen it before in videos if you've watched other videos. It doesn't bother me that much. When my hair is down, it's completely invisible. When my hair is pulled back, it's barely visible. Sometimes on the sides here where my hair is a little bit thin. Doesn't bother me, not a big deal, but those are the only 2 scars I have. Of course, there is scar tissue inside of my mouth where he made those incisions, but it's not something you notice. Completely unnoticeable. And my lip lift, there is a scar right in the crevice of my nose here, but it's completely invisible. It's not something you notice. And even if I told you and you came up really close and looked at it, it just looks like I have a deep crease. It doesn't look like a scar, so that's fine. Next question is the hardest part. What was the hardest part of FFS? Honestly, like, I don't think for me, it wasn't pain, and it wasn't the actual recovery, like the hard part of the recovery. I think the hardest part for me was waiting for the swelling to go down, waiting for those results. Because I'm a very impatient person. I kind of want things now because I'm part of a generation where we can get anything we want at the touch of our fingers to a cellular device. And obviously you can't do that with your body healing. So it wasn't that bad. It wasn't frustrating. It was just like, I kept on waking up and being like, okay, when's it gonna go down all the way? And it took probably 4 months for the swelling in my jaw, especially, to go down 100%, or at least like most of the way. Like I mentioned in the beginning of the video, I don't think I was fully healed until about a year after. And I think at this point I am fully healed and the swelling's gone down 100%. It looks great. It looks exactly how I wanted it to look. But waiting for that swelling was probably the hardest part, if we're being honest. Next question, did it actually help? Yeah, it did. It did. The ways this has changed my life are not measurable. Like, it's blowing my mind. I thought that, you know, after a year of transition, you know, before I had my surgery, but where I was before I went in for surgery, I thought I was happier and I thought, you know, I made a lot of progress, and honestly I did. But after recovering from this, the difference is even more earth-shattering. Like, it's blowing my mind. Like I said, when I go back and look at videos from like a month before my surgery, and I'll put a clip in here, I am so much happier and more content and more just at peace with myself, and it's obvious, and I don't know how to describe it, but just take a look at this clip. It is that time of the month again. Not my period. No, it is Q&A time. I went to Instagram as usual to ask you guys for questions for my Q&A video, and you responded with over 800 questions. It's not even that I was wearing more makeup. It's also like just the way I'm holding myself and the way I talk. Before, I used to pitch my voice up in videos and like post-production just to make sure I felt super, super okay with everything, and I would try really hard, and I would talk in a voice like this all the time just so I could look as feminine as possible. But now I realize that like I'm just really way more comfortable just being being chill, okay? And it's not that I think it's not worth it to, you know, be super femme. It's not about that. It's just about I don't feel like I have to be. And that's way nicer, okay? Numbness. Numbness question mark is the question. So I had complete scalp numbness for about a month after surgery. After that, I had numbness from the scar backwards for probably 3 to 5 months. And then around like the 6 to 7 month mark, I had full sensation back in my scalp. Everything else was totally, I could feel it after about a month. All the local anesthesia had worn off. But immediately after surgery, everything was numb and throbbing. But, you know, a year afterwards, full sensation, no permanent nerve damage, which is cool. I'm happy with that. Revisions. So the doctor I went to, Dr. Spiegel, does, or at least when I got surgery, he had this policy where if there's anything you're not satisfied with a year after surgery, you can go back and get revisions free of charge, as you have to cover travel and lodgings and everything though. And I was like, cool, that's good to know just in case. I personally don't think I want any revisions. The only things that I notice in my face now aren't dysphoria, and it's not like a gender thing, it's just like insecurity. Like, oh, in certain lighting I have a crease here that I don't like. It's not something that I think I need a revision for because it's not my bone. He did an amazing job with my bone structure, and I am super satisfied with the result. There's nothing I would change. This next line just says sickness question mark, immunity. I think I'm gonna go at this from all angles. Immunity, I think, you know, some people they have a bit of immunity to the painkillers that you get after surgery. Thankfully, they worked very well on me. I am a pretty small person. I'm 5'3". It's not like I need a lot in my system to knock me out, you know what I mean? I was taking half dosages for the painkillers most of the time. Sometimes when the throbbing was really bad, like on the 3rd day, I went up to a full dosage, and that knocked me right out, and I slept for like 12 hours. So that was nice. It was cool. It was cool. But there was no trouble with my body being immune to drugs. In terms of my immune system, like, did I get sick? Was I compromised? No. I think I just have a strong immune system, or at least a standard one. I didn't get sick at all. There was no trouble with my health whatsoever. It was totally smooth ride in recovery, really. In hindsight, at least. Next line, things you didn't expect. So actually, I have a pretty good one for this. I did not expect my eyes to look so much rounder or larger, but they do. And I think what he mentioned to me in a consultation, especially for my forehead, was that obviously the brow bone was something I wanted done, but he mentioned that it looked like this part of the bone was hanging over a little bit too. And I didn't notice that, but I'm really glad he worked with that because it was kind of like a bump. Like this whole part was very much a bump, and I noticed that. But even this part, you know, it was out more, it came forward more. Not something I would have caught, but he reduced that as well. So it's very much flat on the sides, and that opened my eyes up so much. And that had a massive effect on how feminine, quote unquote, you know, according to beauty standards right now, my eyes looked. And it's not about them being large or open. It's just about the light coming into my face, right? It's more about the brow bone being flat than it is about the eye shape. But I guess what I didn't expect was for my eye shape to be impacted so much by the brow bone. Does that make sense? Cool. Treated differently, question mark. Ooh, am I treated differently after surgery as opposed to before surgery? Yes, a lot differently. I don't get those weird looks anymore. Usually, sometimes I do because, like, I don't know, maybe I have a bit of I'm shadow showing or something. I don't know. It's pretty much gone at this point, so I don't know what they're looking at. Maybe it's because my face looks different, not because they know I'm trans. It could be a number of things, really. I used to just constantly feel like on guard when I went outside. I felt constantly like I had to defend myself. Like I just constantly felt scared, okay? And I don't feel that anymore. And that is a direct result of people being less of a jerk to me. And it obviously is terrible that certain trans women are treated better over others based on how much money they have to afford surgeries like this. That's complete trash, garbage bullshit. And I hate that, but it is a fact that I am treated better because I pass. And that's something that I would love to destroy. And that's something that I speak about a lot. And I would love it if you guys would also try to remember that if you're not trans, okay, when you're interacting with trans people or when you see trans people online or in the street, if they don't look like they pass as a cis person, that's okay. Because first of all, that doesn't matter, okay? It's not about being a cis person. It's about doing what you need to do to be happy, okay? And for some people, that is not surgery. And for some people, that's not hormones. What it boils down to is it's none of your business how another person looks, okay? And if they're happy, that's all that matters. If they're not hurting anybody, it doesn't matter, okay? And it's you know, it's a larger issue than even that because it goes into this whole class thing where it's like, if you can't afford this surgery, you're seen as less than. And because you're seen as less than, you're considered less for jobs because you don't pass. You might be a disruption according to some people, right? So then you don't get the job, so you can't get money to pay. Like it's a whole self-fulfilling prophecy. And the only way to break out of that is to understand and to act upon the realization that trans people are not less worthy just because they don't look how you think they should look, okay? Amazing. Skin, HRT. Okay, so these kind of intertwine. When I got this surgery done, I had to go off of hormones for 2 weeks before surgery, and I couldn't go on them again until I was moving around so that I wouldn't cause any blood clotting issues, right? Because for the first week after surgery, you're pretty much laying down constantly and not moving. For the most part, I moved a little bit because I was pretty strong and I healed pretty quickly. But the reason you have to go off of them is because they do affect the way your blood behaves, and it can cause issues with healing, especially around scars, right? And they did not want that to be a problem. And this is totally normal. For any surgery you undergo as a trans person, you're gonna have to go off of your hormones. And for most people in general, most cis people even, there are certain medications you have to stop taking before surgery just because they affect the way your blood clots, and that's totally normal. It sucks, however, for trans people because it really does change a lot in 2 weeks. Not physically. You won't see it physically, but it will show up in paperwork. Because when I went and got my blood tested after surgery to see what my hormone levels were, it was a big, big jump. And that made me feel really insecure. And it's not that anything really changed on the outside, it just made me feel bad. And it's kind of silly, but at the same time, your hormones have a big impact on how your brain behaves chemically. A huge impact, arguably one of the biggest impacts. That's probably the biggest change that hormones actually do, is how your brain feels about itself, how it behaves with your whole body. So that was kind of a drawback. That was difficult, but it was absolutely worth it to get this surgery. I wouldn't say it's more worth it to not go off hormones and not get the surgery than to go off and get the surgery. If it's something you feel you need. Like if I could go back in time, I would still do it all over again the exact same way. I wouldn't change anything. But that was tricky. Part of testosterone being in your system is acne, sweating, oiliness, sex drive, just all this stuff that I hated about having testosterone before. And that all kind of came back, especially in hindsight. When it's happening, you don't notice it as much because it's so gradual. But in hindsight, when I got my blood tested and I saw that the hormones were so vastly disparaged, is that the word I'm looking for? They were so vastly different from what I expected. It made sense that I was experiencing certain things that I did not like. So that's tricky and annoying, but whatever. It all went away after a couple weeks on hormones again. So that's fine, I guess. I'm just gonna check Instagram DMs for any last questions that, other people might have sent. Oh, here's a question. Did you ever feel like your new face didn't feel or look like you? Like it was so different from what you were used to that it felt foreign? No. And this is actually something that I think might interest people that are cis or that don't feel the need for these surgeries. I actually saw my face like this before surgery. When I looked in the mirror, this is what I expected to see. It might not be what I actually saw, but in my happiest moments, in the parts of my life before surgery where I felt the most secure in myself, I saw this face. I didn't see the face before surgery. I had no idea I looked like that. So really, I just look in the mirror and see myself now. I don't see a different person. And that might be partially due to the doctor that I chose delivers a very natural result. You don't look like a different person entirely. There are doctors that give you a way more dramatic change if that's what you're interested in, if that's what you want for yourself. But I was sure that I wanted to look like me. I still wanted to resemble me. I wanted to resemble my mother. That's why I chose a more natural result. Maybe that's why I never had that feeling. If I had a larger dramatic change, maybe I would have that feeling, but I can't say I experienced that. Thank you so much for hanging out with me. Again, if you guys want to check out my surgery playlist, you can find that in, I just moved the camera. I have to re-record the whole thing now. Hold on, slow down. Thank you. Thank you, camera. Slow down. If you guys want to see that playlist, it's linked in the description. Is it still moving? I have to do this anyway. Linked in the description box, okay? And I'm going to be undergoing 2 other surgeries very soon. Body surgeries, breast augmentation, and a hip thing. Hip thing, because the actual name doesn't really explain that it's a hip thing. Okay, but I will be doing full playlists and full vlog recovery things on those as well, so you can see all of that as soon as it happens, and it will be very soon. So keep an eye out for those videos. I will see you again very soon. I love you so much. Until next time, just remember, if you want to make, a change in your life, don't be afraid. Just try with all your might and chase it, and it's worth it. It's worth it. It's worth chasing those things. 4 years ago, if I, could go back in time and talk to myself 4 years ago and be like, hey girl, this is what you're gonna look like and be doing, I would be like, bitch, you're a fucking liar. Get out of my face, or... But the reality is, my life has changed so much in 4 years that it's unrecognizable, and that is in a big part thanks to all of you guys, and I really appreciate your support and your love and being a part of this family. I love you so much. Thank you. You've changed my life in a way that I cannot explain. I should have mentioned this earlier in the video, but the crowdfunding you guys did to make this surgery possible for me, that I will never be able to repay. I mean, maybe I could theoretically if I ever get really rich, right? But I will never forget that. Every time I look at my face, I remember you guys helped change my life forever, and that feeling will never leave me because it's my face, I love you so much. Have a good day. Be safe. Drink lots of water. I love you. Oh, I did it again.